Hello, my name is Nicole Gervais, and this is my Week 4 case study presentation. This week's case scenario takes place at a large catheterization lab consisting of approximately 27 cardiologists. All of the cardiologists work in private practice and are not employed by the hospital. However, approximately 20 of them use the hospital as their primary facility, and 7 use the facility as their secondary facility. The top forms of financial reimbursement for patient care are from Medicare coverage, Medicaid coverage, third-party insurance enrollment, and self-pay or self-insured patients, and they are ranked in that order. Of those reimbursement forms, approximately 25% of the revenue is generated from insurance reimbursements, 18% from self-insured payments, and 57% of revenue is written off due to contractual write-offs as well as non-payment. In our scenario, the top 11 cardiologists in the cath lab are using 11 or more different vendors for their catheters and stents. The new financial manager has reviewed the cost of utilizing all of these vendors and has concluded that by consolidating the number of vendors whose supplies are ordered from, the facility can save 29% in cost, which equals approximately $1.7 million annually. After presenting this information to the cardiologist, many agreed that cost savings was important, but they were not willing to acquiesce to the 2 suggested vendors by the finance manager. Upon hearing this, additional research was conducted, and it was discovered that each cardiologist was associated with their chosen vendors through the use of consultations, product development, and patents. From these relationships and partnerships, the cardiologists were paid between $250,000 and $500,000 per year. Immediately, there are some legal concerns regarding this scenario. Specifically, we'll be looking at the anti-kickback statutes, the physician self-referral law, which is more commonly known as the Stark Law, and the Federal False Claims Act. Anti-kickback statutes establish criminal penalties for individuals and entities that knowingly and willfully offer, pay, solicit, or receive remuneration in order to induce business for which payment may be made under any federal healthcare program. Examples of these programs include Medicare, Medicaid, TRICARE, and the Veterans Health Administration, just to name a few. Medicaid is also funded by state taxes, so state laws regarding anti-kickback laws when treating Medicaid patients would also apply in scenarios like this. Secondly, we have the Stark Law, which prohibits physicians from ordering designated health services for Medicare and Medicaid patients from entities that the physician or an immediate family member financially benefits from. Under the law, durable medical equipment and supplies are considered designated health services, so receiving financial compensation for utilizing certain supplies would violate the Stark Law. Lastly, we have the False Claims Act, which is the U.S. government's primary litigation tool for combating fraud, which provides that anyone who knowingly submits false claims to the government is liable for damages. This law covers any misuse, fraud, or abuse of publicly funded programs such as Medicare and TRICARE, among others. In this scenario, we also have to examine the cath lab's corporate compliance program. A corporate compliance program is an internal set of policies, processes, and procedures that an organization implements to help it act ethically and lawfully. These programs typically include some sort of code of conduct, the designation of a compliance officer, they outline policies and procedures, offer education and training programs. They also have lines of communication, auditing and monitoring programs, detection and corrective action initiatives, and they also enforce disciplinary actions in accordance with any outlined standards and guidelines. We must also examine the medical staff bylaws of the cath lab. Medical staff bylaws are defined as the standards governing the practice of medical staff members that are typically voted on by the organized medical staff and the medical staff executive committee, and then approved by the facility's board. All staff must abide by these laws in order to maintain employment and continue practicing within the healthcare facility. This scenario is a little bit tricky since the cardiologists being reviewed in this case are not employed directly by the hospital. However, they have been given privileges to treat patients, meaning they have been credentialed by the facility and belong to the medical staff, most likely as associates. For this scenario, I would recommend that the bylaws be reviewed immediately. It's important to figure out if any are in place, and if they are, what has already been established. Next, I would want to review if there are any standards or codes of conduct that address supplies and vendors, as well as disclosure of conflicts of interest. Next, if the bylaws do not address any issues, I would want to review the process of creating or updating the bylaws and what this process would entail. If there are bylaws that address these issues, I would want to review the actions, or if the actions of the cardiologist violate any existing bylaws or codes of conduct. Next, I would recommend creating and updating any bylaws addressing these issues that might be weak or non-existent. And lastly, I would utilize the Medical Staff Executive Committee in order to initiate any amendments or additions to the bylaws that need to address these conflicts of interest. It's also important to consult with the legal team and review the corporate compliance program. I would review any existing guidelines regarding fraud, misuse, and conflicts of interest. I would review the compliance program, if it's being enforced, and if it's in accordance with established standards and protocols. And the program itself should be reviewed to ensure that the program is addressing auditing, detecting, education, and training, and making sure those things are occurring. Additionally, the compliance officer, assuming that there is one in this scenario, should be reviewed for their performance as well, especially to miss something kind of big like this. It should be reviewed to see if they're fulfilling their responsibilities as the compliance officer. I would then recommend strengthening any weak areas that need to be improved upon, whether this is auditing and detection or enforcement of guidelines and policies, anything like that. And I would also encourage all staff, but especially the cardiologist in this situation, to disclose any and all conflicts of interest, specifically regarding the vendor, since that's what we're addressing in this case. So to conclude to kind of summarize this case, my resolutions to this case study include encouraging staff to immediately disclose any and all conflicts of interest. I would also recommend reviewing these disclosures and examining if they violate any federal or state laws regarding misuse, abuse, or fraud. If there are any indications that there are violations, I would have the compliance officer turn over any findings to the legal team, and then those violations should be disclosed to the appropriate state and federal agencies so that corrective actions can be taken and that the facility can rectify those violations. The corporate compliance program should also be reviewed, as well as the compliance officer. Program should be updated as needed to ensure compliance with federal and state laws. And lastly, if necessary, any trainings and educational meetings should be conducted to ensure that all staff are informed of compliance guidelines, any new and existing medical staff bylaws that might come from these reviews, and the organization's code of conduct. And so that is my presentation regarding the week 4 case study, which involves federal compliance as well as medical staff bylaws. Thank you for listening to my presentation.